Kidney cancer is an oncological disease. Look at this picture, shows that healthy kidney with tumor, CT findings. Look at this, and MRI findings. Detail going on. Introduction. Kidney cancer, also known as renal cancer, begins in the kidneys, two bean-shaped organs located in the back of the abdomen on each side of the spine. The primary role of kidneys is to filter blood and produce urine. Which removes waste and excess fluid from the body. Kidney cancer is among the 10 most common cancers in both men and women, with early detection improving the prognosis significantly. A definition: kidney cancer is a type of cancer that originates in the cells of the kidneys, with renal cell carcinoma being the most common form. It often presents with symptoms like blood in the urine and back pain, and treatment typically involves surgery, target therapy, or immunotherapy. One, renal cell carcinoma, RCC, the most prevalent type, originating in the renal tubules of the kidney. 2. Transitional cell carcinoma begins in the renal pelvis, where urine collects before moving to the bladder. 3. Wilms tumor, a rare childhood cancer. 4. Renal sarcoma, rare cancer that originates in the connective tissues or blood vessels of the kidney. 5. Clear cell RCC, a subtype of RCC characterized by pale or clear cells. 6. Papillary RCC, cancer cells from finger-like projections. 7. Chromophobia RCC, rare cancerous cells, appears pale or clear but are different from those in clear cell RCC. Causes. The exact cause of kidney cancer is often unclear, but several factors are believed to contribute. 1. Genetic mutations. Abnormal changes in DNA can cause uncontrolled cell growth in the kidney. 2. Family history, inherited gene mutations like those in Van Hippel-Lindau disease may increase risk. 3. Lifestyle factors, smoking and obesity significantly rise in the risk. 4. Chronic kidney disease, long-term kidney problems or dialysis increases the likelihood of developing kidney cancer. Risk factors: 1. Smoking doubles the risk of developing RCC. 2. Obesity, excess body weight in linked to hormonal imbalance that may promote tumor development. 3. High blood pressure, hypertension is strongly associated with an increased risk of RCC. 4. Genetic predisposition, conditions like Van Hippel-Lindau disease and hereditary papillary renal carcinoma heighten risk. 5. Occupational hazards, exposure to chemical like asbestos, cadmium and trichloroethylene increase the risk. 6. Gender and age, men and people over 50 are more likely to develop kidney cancer. Complications: metastasis, cancer may spread to the lungs, liver, bones, brain. To anemia, loss of healthy red blood cells due to kidney malfunction or cancer treatment. 3. Hypertension, tumor may trigger increased production of renin, a hormone that regulates blood pressure. 4. Kidney failure, in advanced stages, cancer can impair kidney function leading to failure. 5. Blood clots, cancer increases the risk of developing clots. Pathophysiology, kidney cancer usually begins with mutations in the DNA of renal cells, particularly those in the renal tubules. These mutations trigger unchecked cell growth and tumor formation. In RCC, for example, mutated cells from a mass in the renal cortex disrupting normal kidney function and over time can invade nearby tissues and metastasize to distant organs. Step-by-step pathophysiology of kidney cancer. 1. Initiation of genetic mutation. 2. Uncontrolled cellular proliferation. 3. Angiogenesis, formation of new blood vessels. 4. Inversion of local tissues. 5. Metastasis, spread to other areas. 6. Immune system evasion. 7. alterations in renal function. 8. Paraneoplastic syndromes. 9. Local and systemic symptoms. Flank pain, unexplained weight loss, fatigue and anemia. 10. Advanced diseases and organ failure. This process reflects the complex and progressive nature of kidney cancer, starting from genetic mutation to the potential spread throughout the body. Signs and symptoms. 1. Hematuria, blood in the urine which may be visible or microscopic. 2. Flank pain, persistent pain or discomfort on one side of the body. 3. Unexplained weight loss often occurs as cancer progresses. 4. Fatigue, feeling tired and weak. 5. Lump or mass, a palpable mass on the side or lower back. 6. Fever without any infection. 7. Loss of appetite and anemia, common in advanced cases. Diagnosis. 1. Imaging, CT scan, MRIs and ultrasounds provide detailed images of the kidneys and help detect tumors. 2. Biopsy, a tissue sample from the kidney may be examined to confirm malignancy. 3. Urine analysis. Test may reveal blood or abdominal cells in the urine. For blood test, check for markers of the kidney function such as creatinine and blood urea nitrogen levels. 4. Cystoscopy, a camera inserted into the bladder may help rule out other causes of hematuria. Nursing diagnosis. 1. Acute pain related to tumor pressure on surrounding tissues. 2. Risk for infection related to compromised immunoresponse or treatment side effects. 3. Impaired urinary elimination due to obstruction by the tumor. 4. Imbalanced nutrition due to cancer related weight loss and anorexia. Management. First, medical management. 1. Surgical intervention, potential or total nephrectomy, removal of part or all of the kidney is often the primary treatment. 2. Ablation therapy. Techniques like radiofrequency ablation destroy the tumor without surgery. 3. Targeted therapy. Drugs like sunitinib or basopanib target cancer specific proteins to slow tumor growth. For immunotherapy, boost the body's immune response to fight cancer cells. 5. Radiation therapy used to relieve symptoms in advanced stages but not typically a first line treatment. The nursing management: 1. Monitor vital signs. Pay attention to signs of infection, changes in blood pressure and kidney function. 2. Pain management: administer pain relief medications and use non-pharmacological methods like positioning. 3. Nutritional support: encourage a balanced diet, provide small frequent meals and address nausea or anorexia. 4. Patient education: teach about treatment, plans, side effects and signs of complications. 5. Emotional support: offer counseling and refer patient to support groups. Treatment: 1. Surgery including parietal nephrectomy, removal of the tumor while spread part of the kidney. Radical nephropathy, complete removal of kidney, adrenal gland and surrounding tissues. 2. Targeted therapy: drugs that specifically target cancer cell pathways. 3. Immunotherapy helps the immune system recognize and attack cancer cells. 4. Radiation therapy used mainly for palliative purpose. 5. Chemotherapy less effective for kidney cancer but may be used in certain advanced cases. Psychosocial medicine: 1. Emotional well-being: anxiety, depression and fear are common. Reaction to a cancer diagnosis: patients may benefit from psychotherapy, support groups and family counseling. 2. Body image concerns: nephrectomy and treatment side effects can affect self-esteem, requiring supportive care. 3. Coping mechanisms help patients develop strategies to cope with chronic illness and potential life changes. Prevention: 1. Stop smoking. Reducing or eliminating tobacco use lowers the risk. 2. Healthy weight: maintain a healthy weight to reduce risk. 3. Control blood pressure. Managing hypertension can prevent kidney cancer. 4. Avoid chemical exposure. Minimize exposure to harmful chemicals in the workplace. In conclusion, kidney cancer is a significant health concern, especially with increasing risk factors like smoking, obesity and hypertension. Early detection through imaging and biopsy is key to successful treatment, and management includes a combination of surgery, targeted therapies and immunotherapy. comprehensive care including addressing the physical, emotional and psychosocial aspects to improve patient outcomes. Thank you. Have a nice day.